Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, why it's heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in and join in. Today, well, it's a Friday. It is going to be a get 'em up out of town version of the show where we allow you at any moment to give us a call and get it off your chest, get it off your mind. I've given you a lot to get off that chest for years recently. A lot of new concepts. I'll try to be pulling them all together today to make a final picture that should be emerging. I hope you're getting the picture. I hope it's starting to resonate with you, and hopefully you'll be able to see the importance, as I do, from the health perspective. Anyway, whatever is on your mind is okay with me. The number to do that, in other words, get it off your chest, is 412-825-6262. That's 412-825-6262. Open phones today. Call us up. I'll listen for your knock on the door, and as soon as I hear it, I'll let you in the store. Now, calendar events. Here it looks like it's shaping up. When Monday rolls around, we're going to be back with Roland Thomas, talking about what I think to be the most unique single supplement I've ever come across. It's made my job a lot easier. So many different categories of supplements that really a person should have in their program, but it turns out that if you get all these and move to purchasing 1 and 2 and 3 and 4 and 5 products, this could be quite an expensive venture. Well, the BAC, bioengineered algae concentrates that have been emerging from the work of Dr. Michael Kiriak. Now Michael hooks up with Roland Thomas, a naturopathic physician from Canada. The result from that is a company called BioAge. We're going to be talking about the BioAge connection on Monday when Roland rejoins us. We'll give you a quick snapshot resume of the Michael Kiriak story, but we're going to get hot into the actual product. F1, F2, and F3 are the names of the products. F3 is the top of the line, and it contains literally every supplement that you require, all rolled into one. We'll be talking about that on Monday. It certainly is available here, and I guess a couple other places in the Pittsburgh area have procured it and do have it available. I think it is the finest supplement going, and actually in the long run will save you so much money compared to buying one of all of the lines. You know, we're talking about a multiple, and then macro minerals, and then trace minerals, and then essential fats, and then enzymes, and then amino acids. And then the list just keeps going on and on. When you start trying to cover the entire board and you're replacing it every month, it does get pretty pricey. On Monday, then, Roland Thomas. On Wednesday, a gentleman by the name of Mario DiMartino is going to be coming here talking about vanishing acne without chemicals. Should be an interesting discussion. You'd think that maybe this is pertinent to a teenage listening audience, when in fact, quite a few adults tend to be afflicted by these problems also. Mario DiMartino will be our guest on Wednesday. Then in the following week on Wednesday, Susan Smith-Jones will be back early. She was supposed to and still will be returning with us on September 7th, as you would well know. Going to be talking about Spices That Heal. We set that date when she was last with us here on the 3rd of August, but I get an emergency email from her the other day saying, could she please, pretty please, come on to the radio show sometime in August. She wants to talk about sprouts. That's an interesting topic, and we've had it covered once before, 3 years ago, I'm going to say, at a minimum, and then nothing about it over this time frame. I'm interested in hearing what Susan has to say about sprouts. I'm guessing you will too. We'll do that on the 31st, the very last day of August. Don't want to miss the point that MCG testing now resumes coming up next Thursday here in the office. MCG testing returns here, and now it's going to be having a permanent place and level of prominence in my office because we have procured the device. It will be here at all times, and we'll be able to do testing on a continuous basis. As you should well know, this is a test that will be able to give us a pretty good idea of what the status of your coronary arteries are, and do so without any risk to you whatsoever. This then allows of a numerical score to be placed on that status somewhere between 0 and 20. And depending on how far you're moving toward the 20 and how far away from the 0, it'll be determined then how frequently you are allowed to retest and have the insurer pay for it, which should give you a little hint about how important they think this test is. That they're going to be able to allow you to be retested as we continue to move along. And now here's the best part. With MCG testing, once we learn what the status of the coronary arteries are, we go about to develop a plan to actually correct them, to actually dwindle and lessen the amount of plaque to be found in those arteries. I find that that's a real disadvantage. I think it's the message that I keep trying to bring to you. The real disadvantage, of course, is putting this machine or this device in the hands of a conventional doctor who is more than willing to assess the coronary arteries, but then, and it's so depressing to have to say this, will then do absolutely nothing about correcting the problem well into the future. The conventional medical doctor will be able to maintain your medicines. The conventional medical doctor will say very powerful things and very sophisticated things like exercise, like what's your diet, like don't smoke. I keep thinking of those three things because my then 9-year-old used to come back from school when he was in 2nd grade telling me about these same three things. It's almost embarrassing to think that this is what the conventional medical community has been reduced to, that the same battle cry given to a 9-year-old is what passes for medical advice by these brilliant doctors who, as we found out, really don't know what to do with how to correct this. Coronary arteries need to be corrected. All arteries need to be corrected. The real fun starts here at this office. Once we know the status of a patient's cardiovascular disease, and then lay out a plan to go to correct it, because we will absolutely do that, and you want to be a part of it. So MCG testing does return. It'll be back with us here starting on the 25th. That date is already filled up. I'm not so sure. I think there may be a slot or two left for the September 8th encounter if you have been previously tested with MCG in the past, or if it may be even a first time for you. Give us a call today, right after we get off the air here at the 9 o'clock hour. You want to talk to Kim. The number is 724-942-3002. MCG testing has returned. Product-wise, I keep bringing to your attention, RTD dressings are available here. If you're a diabetic, this is a special plea and cry out to you. You need to have a sophisticated, and I mean a very sophisticated way to correct the wounds that you may be getting, that just maybe a paper cut. And in a diabetic, a paper cut is very serious in terms of the havoc that it can cause. Anyway, RTD dressings, a very unique way to deal with these wounds. You don't have to be a diabetic to utilize them, but if you're a diabetic, it just is a must. And I don't believe that the RTD dressings are available in any other venue in the entire Western Pennsylvania area, except for some hospitals But from an office setting, I don't think you're able to purchase them. We have them here. Give us a yelp. And of course, 4-to-1 oil, which we'll be talking a little more about in a moment or two, is also obtainable here. It's manufactured and put together by the Body Bio people, Edward Kane, Patricia Kane's company, and it's been a product since 1995. And the reason 1995 is so important, because they found out in 1994 what the correct replacement for essential fatty acids were, and we've already announced it many times in the last few weeks, and I'll be trying to pull that concept together this morning and allowing you to comment too, because many of you, this is still a issue not sitting well with you. It has flown in the face of everything you've held sacred, especially in terms of fish oil. I find it's the reluctance on the part of you out there to move where the science takes you and rely on emotion with respect to how it is that you're going to proceed, I think is questionable. You really got to take a look and be very careful. So, let's do this. Let's take a short break. When we return, we have opened it up to you today, 412-825-6262. That's 412-825-6262. Anything on your mind is okay with me. We will be back in just a moment.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on this Friday version of the show. Yes, it is a Friday. Yes, it is a get 'em up out of town version. You can feel free to give us a call and get it off your chest, whatever seems to be bothering you, whatever inquisitions you'd like to make. I often say that if I can't come up with an answer, and it's pretty frequent that I don't, I always turn it over to my listeners, and they absolutely have wonderful recommendations for you. So you've got a vast resource here, ladies and gentlemen. Your medical query is being conquered by many listeners frequently, and these are people that call up to our show. And if you wanted some help, you can give us a call at 412-825-6262. That's 412-825-6262. Now, over these last few weeks, I think I've pretty much rocked the boat a lot with my listeners and have come up with some scientific facts that have flown in the face of what we have held dear and true for so long. Turns out that we've done so without the scientific basis in order to allow us to do just that. So when science finally brings information to us, it may be something that we believe. It may come in conflict, I guess a better way to say this, with things that we've held to be true, but yet, if you think about how they were originated, how they got to be such a well-entrenched medical approach and health promotion approach, if you take a look at how that all comes to be, and you find out there's no science behind it, then you really have to go with the newer science that makes these new concepts, the actual component of a medical regime and protocol that you can feel rest assured will help you maintain a level of health that heretofore you can't if you continue to pursue the old way. Now, by old way, our first concept that we brought to you, and now maybe 3 weeks old, maybe a little longer than that, was that mantra of fish oils can be hazardous to your health. In fact, I don't think the can be is part of that. Fish oils ultimately will be hazardous to your health simply because of the high concentration of these very sophisticated derivatives of EPA and DHA. And so when I first brought this to you a few weeks ago, you had to really question something I think has been a part of just about everybody's supplement regime that I know of, because I'll tell you what, I help put people on these supplements, and fish oil was high on the list. It, however, cannot remain there. It has to be knocked down a peg or two, or quite a few pegs, because there is a problem, a biochemical problem that will ultimately ensue with continued exposure to vast amounts of these very sophisticated derivatives of EPA and DHA. The body was never meant to handle such large amounts of those substances. And if you think about, as I said, with one capsule of fish oil, usually 1,000 milligrams contained in a capsule, or 1 gram. When you figure it takes 17 fish to make 1 capsule of fish oil, you begin to get an appreciation for just how much concentration of these substances has to occur. In other words, to get it to you, to get that capsule in your hand so that you can take it. Way overboard with respect to the levels of EPA and DHA. So when we learn, and we finally can no longer avoid proceeding that we know that it's been scientifically determined that there must be a ratio of 4-to-1 of omega-6s to omega-3s. And that not only is the ratio of 4-to-1 scientifically been proven, but that the components of the 4 and of the 1 are also spelled out. The omega-6s must be in the form of linoleic acid. The omega-3s must be in the form of alpha-linolenic acid. And the representative parent compounds of each of those two, first the linoleic, is either primrose oil or sunflower oil. And in the case of alpha-linolenic acid, the representative of the omega-3 community, that is flaxseed oil. Must be in this ratio of 4-to-1 of omega-6s to omega-3s. And they must be parent compounds. EPA and DHA are not parent compounds. They are derivatives, and the body will make what it needs, and it needs a very small amount of those two substances. If you overload with EPA and DHA, as you will, by taking fish oils, you will upset the apple cart, and ultimately the membrane is where is the structure in the body that will pay the price for your indiscretions. Well, we'll pick up on that in just a minute. There is a knock on the door. Come on in the store. Hello, and what's on your mind?
Hi, Dr. Courtney.
Hi.
I was one of the guys that came in through the second wave that you were having the
MCG testing?
Yes, I was.
Okay.
And anxious to have it done again.
Good.
And but I'm having a little bit of trouble here. My cardiologist came through a blood test like that, and he said my iron count is extremely low, and he says that the size of it are very small.
Okay, does he think you have anemia? Does he think you have anemia?
Yeah, anemia.
Okay.
And what it is, it's I guess on a scale from 12 to like 300 that they use in that type of a scale. He says mine's a 3.
Okay. Well, I think you're revealing a medical issue here that I'll have to spend a little bit of time to try to explain. You're talking about a ferritin level that has a normal range, and this should be the tip-off, a normal range of between, I've seen it anywhere from 10 to 300. I've seen it 40 to 300. But as I've continually instructed my listeners to appreciate this, assessing ferritin levels, anytime that you find a widespread range of, let's say, 10 to 300 as the normal range, what you're really seeing is a medical community that just doesn't understand how important the 3 or the 300 really is. If you can find such a wide range and call that normal, what does that really say about the ferritin level? Now, in your case, if you really are extremely low with ferritin, and then under the microscope, which is when they do a CBC, they actually take a look. And the CBC stands for a complete blood count. They actually take a look under the microscope to see the quality of the red blood cell itself. If there is a assessment done on you that's revealing hemolytic anemia, okay, where you have such low levels of iron that the quality of the red blood cell visually shows that it's afflicted, then you do have a serious health problem that needs to be dealt with. Now, that doesn't have anything to do with your MCG testing. I don't know, maybe you didn't make that association, but the status of your coronary arteries isn't affected in a positive or negative way with a ferritin of as low as 3, okay? So there has to be an investigation done on why your ferritin is so low, but at the same time, the status of your coronary arteries continues to need to be assessed in terms of how much plaque you have in those arteries. I think maybe the confusion that I might have caused is I use ferritin levels oftentimes in trying to determine if it's too high. Is it a risk factor in developing plaque inside of arteries? Well, you may not have that as a risk factor. It appears your ferritin isn't too high. If anything, it's too low. But there are 9 other risk factors that could really put into play quite a series of events that can lead to a lot of plaque deposition. And maybe that's the confusion. Am I right about that?
Yeah.
Okay.
I had some stool tests done through homeopathic doctor, and it came back, and it tested positive for blood in the stool. Now, I went to a regular doctor, and real quick they want to put me in for an upper and lower GI, I guess, for they scope you out. I'm a little hesitant about that, because I'm the one that had trouble with a heart surgery, where they blew up my arteries and stuff like that, so...
Well, what's being done here, and interesting that a naturopath knew more about how to assess the status of the colon. It's always going to be in a male. If there's anemia in a male, that's quite abnormal. And the first place to go look for the bleeding, because that's what they're thinking that you may have an abnormal bleed in the GI tract, is to do what's called a Hemoccult test. And I think that's what your naturopath did. And just with a smear of fecal material and a developing fluid that you can place on it, you can tell literally within moments if you have microscopic bleeding, and that would be a perfectly appropriate way to proceed us to the cause. So learning that your ferritin was so low has tipped the medical doctors off to go investigating why it's so low. And one of the first things that will be done in the male, at least, is to determine if there's a GI bleed. Now, it's funny, 10 or 15 years ago, hemoccult testing was standard in every doctor's office that I know of. Now, they tend to want to go move right to the endoscopy and the colonoscopy, looking for the bleed, instead of doing that little test first. Well, in your case, the test is positive. There is bleeding going on. Now they need to find out where. Is it upper GI or lower GI? And they'll be able to determine it. So your doctors are doing right by you and for you, but I don't want you to think that because your ferritin's low, you can't have a large amount of cardiovascular plaque. No, you absolutely can. They're two separate issues, two separate treatment approaches, and that one is not one is exclusive from the other, and that even though ferritins in your case are low, any one of the other 9 risk factors can be high. I hope I haven't confused you with that answer. I'm just trying to point out why they're doing what they're doing, and they're doing it right.
Okay.
Okay?
Well, they told me they want me to quit taking fish oil.
Oh, well, this is very good because I'm also saying the same thing, and I don't know why. You know why they think they may be telling you not to take fish oil? Because they feel,
Too much.
yeah, they feel that it's interfering with your ability to clot, which I think they're almost looking at fish oil as some heinous substance that'll kill you. When in fact, I'm saying it's not good for you, but it's not because it slimes the platelets, because that's what fish oil does do, and it does make it so an artery or anywhere that a coagulation could occur would have to be of a sufficient amount. You should have a large enough wound that the clotting will occur, and taking fish oils won't prevent that. So they're off. They're not thinking right. If you were on Coumadin, that'd be another story. But if you're just on fish oils, which I say you need to get off of for other reasons, the reason is not because it slimes platelets. I think that's a bit of an overkill there, but that you need to go find out where the bleed is and get it corrected.
Well, would it be okay to take a little bit of iron supplement?
Oh, yeah, absolutely. In your case, yeah, you should be placed on ferrous sulfate, not ferric, ferrous sulfate, and you're going to need to replace your iron stores and need to bring that ferritin level up. But in the face of a bleed going on somewhere in the GI tract, it's almost going to be that it's going to be a futile battle unless you stop the bleed. That's the most important component here. Where is the bleed? And you got to cauterize those vessels wherever they are. And the good news is between endoscopy and colonoscopy, that job should be able to be done without any surgical intervention at all.
Okay.
Okay?
I think you're kind of leaning toward a stomach ulcer, but I'm not sure.
Well, one look, an endoscopy, which takes 10 or 15 minutes, will reveal that in no time flat. So do not hesitate. It sounds like good, sound medical advice that you're getting.
Okay, now am I understanding that you have your own machine to do the cardiac test?
Yep, it's here. Give us a call here at the office. Kim will let you know when the next slots are open for, and feel free to come on in to do it. Even while you're getting your workup for your GI bleed, that does not mean that you can't get the test for the MCG and repeat test for it and think that it would be unsafe for you in some way or could be potentially harmful to you. No, absolutely not. Okay?
Okay. I'd like to get it in. I'm scheduled at the end of the month on the 28th, and I guess you're filled up for this month.
Yeah, the 25th was filled almost immediately. September 8th was the next time up. Check with Kim on it. And if that's filled, I'm going to ask Kim this morning when I get off. I'll give you all another date. There'll be frequent dates now. There'll be monthly, sometimes twice a month, to take care of all you folks that had MCG testing before and allow for a new group of people who have had no MCG testing to become involved with it. All right, sir?
All right. Thank you very much.
Absolutely. Get to the bottom of that GI bleed. It really is an important issue to get. You can't get the ferritin level straightened out until you get the GI bleed taken care of. Okay? All right. There we have it. Pretty extensive history on this gentleman, but I think maybe the confusion begins. I tell you that ferritin testing is something that I do to point to what could be a risk factor for developing plaque in an artery. And ferritin levels are one of the 10 lab tests. But in this case, with this gentleman, his ferritin is extremely low because he has a bleed, because he is losing blood and his ferritin levels are dropping. But that doesn't mean that it's exclusive, and that because the ferritin levels are dropping, he can't have a plaque problem. No, they're two different problems. They're mutually exclusive, and while he's working on one, he can work on the other, and we'll let it go at that. Let's do this. Let's take a short break. When we return, we'll still open it up for you. If you're out there and want to give us a call and you've got a special issue you want to talk about, the number to do it is 412-825-6262. When we return, concept number 2 was brought to you not too long ago. The number 1 and the only cause of cancer. I think I'm going to review that just in a moment with you too. Be right back with more of the goods.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones a blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health here in this Friday version of our show where we have opened it up to you. It is a get 'em up out of town version of the show where we like to open it up to your questions and queries. The number to do that, 412-825-6262. That's 412-825-6262. We do have a knock on the door. Come on in the store. Hello and welcome aboard. What's on your mind? Hello.
Good morning, Dr. Courtney.
Absolutely. Good morning to you. How are you today?
Okay. Good thing it's Friday. That's all I have to say.
Yeah, I'm looking forward to the weekend, too.
I have a couple questions, but I wanted to put my 2 cents worth in for that gentleman. Something simple he could do in his diet would include some beets. Because beets, I believe, raise the iron.
Oh, absolutely. There are foods. We could have got into that. However, when your ferritin is 3 and it's that low,
yeah,
you may need a truckload of beets. And so for anyone else in their regular diet, now the beet thing would be fine. It's just, he's going to have to taking the ferrous sulfate as his main supplement until they could. Well, to take that supplement almost is not even helpful because if you have a GI bleed, you better go get the bleed corrected first. Once corrected, then every bit of ferritin you take will help resume the accumulation of a ferritin pile once again, and then ultimately the diet and all those other things can help enhance. But until the bleed is straightened out, you're working against a sort of an unfixable problem. So it was good advice about the beets, but to back the truck up to the kitchen in this case won't be able to solve this problem. Next thing on your mind, go right ahead.
Regarding the fish oil.
Oh yeah, how you doing with this?
Just real quick, I just stopped it for one day, and honestly, Dr. Courtney, for me, the Nordic is it just I guess helps with the inflammation that I have, with the diabetic neuropathy.
Now you can't just I agree.
Oh no, I was still taking it in a lower combo. Like I have this one, I won't mention the brand, but it's I guess more toward what you were speaking of. It even has 5 omega-5s, omega-7s, and zeaxanthin in it, and a little bit of D3, but it's more the full spectrum omega.
Okay.
Which I kind of like, but honestly, for me, I don't know that I can get away from my Nordic.
The idea is that the price you'll pay for that, there's quite a bit of consequence, and I hate to think that for an anti-inflammatory component, that if you can resume a fatty acid regime that puts you in the 4-to-1 category, you will get the anti-inflammatory thing you're looking for. I just don't know the supplement you're taking, and I know you think it's a wonderful supplement. It has all sorts of omegas 3, 6s, 9s, and 5s, and 42s.
I've never even heard of 5 and 7s. I guess they're derived from plants.
I'm not familiar with them too. I'm not familiar with them too. Although I know about omega 9s.
It's just the buckthorn theory, I guess, is the omega 5.
Okay, I've heard of the concept. Yeah, but you got to have this replacement of the essential fatty acids, which are only the omega 6s and the omega 3s.
Okay.
Those are the ones your body can't make. So for those of you out there, and thanks for bringing it up, because I think it's a very appropriate comment. I've had people call up to tell me that they are very happy with their fish oil, that they have a medical issue, so in your case maybe it's an inflammatory issue in joints or whatever, and that they're very reluctant to get off of their fish oils because they get a benefit that you've just described a moment ago, that you're by taking the fish oils, you have an anti-inflammatory component that you very much like. However, 2 things to say about that would be, you can have the same anti-inflammatory effect if you take the ratio of the right amount of the omega-6s, omega-3s. And number 2, you will suffer a consequence for overloading with EPA and DHA. And it has much more significant of a price to pay other than your joints. And it has to do with, well, the concept I was going to move to next is something as potent as how to develop cancer. My goodness gracious, what's more important than that? So, thanks for the call. Any other comment you want to make?
Yeah, one more quick thing with the MCG testing. Is there a way to get pre-authorization from my insurance? Because I happened to call my provider the other day, and they said he couldn't really help me a whole lot until she passed me along to a supervisor, which I was on hold for 20 minutes.
Who is your insurer by any chance?
I'm sorry?
Who is the insurer?
BCBS of Pennsylvania.
Well, I only know of a couple insurers that don't pay for this test. And when it comes to qualifying you, pre-qualifying you, it's our job to make sure that we get you qualified before we even give you the test.
Oh, okay. So that would be done automatically.
So it's done here automatically.
Okay.
Okay?
That's good. I want to schedule in. When is the next opening?
The 8th of September, unless that's filled. And if it is, I'm going to find out when I get off air today. And I'll come up with a new date by the time next show rolls around.
Okay.
Okay?
Right, thank you, Doctor. Bye-bye.
Absolutely. There you have it. 412-825-6262. Feel free now to comment on the fish oils that you take and how they may be helping you as an anti-inflammatory. I can appreciate that because EPA plays a role in prostaglandin synthesis. And if you really overload the system with EPA, you do get an anti-inflammatory bonus. But you get such a negative component to the structure of your cell membrane all over the body that is hardly worth that, when in fact, if you take the right combination of omega-6s to omega-3s from the parent oil compound, you will get the anti-inflammatory component that you might be looking for. So, enough on that fish oil thing for now. And let's move to concept number 2. Because it was a few days later after I brought into play the fish oil that I came up with a pretty important show, which I thought was a new slant on this very sensitive and quite important issue of cancer. Because I said, actually, if you take a look at it scientifically, once again, going with the science, that there's only really one cause for cancer. Only one. And that happens to be the inability of a cell to be properly oxygenated, and if it falls below a 35% threshold, it isn't as though you could get cancer. It is that you will always get cancer in those wherever those cells are. And that's a very potent statement to make, and it's been made by a Nobel Prize winner called Otto. His name is Otto Warburg. And it's never been refuted. It's only been confirmed. So, only one way to get cancer. You can't oxygenate those cells. You will not be able to avoid cancer. And therefore, there'd only be one way to prevent cancer, and that would be to assure the cell that it will always have an oxygen level that never falls below the 35% threshold. Now, hang on to that thought for a moment. We have another caller. Let's bring him in the store. Hello and welcome aboard. What's on your mind?
Hey, good morning, Dr. Courtney.
Hi.
Well, you certainly stirred it up last week. I got a lot of calls about that show.
Ah, you're getting calls too, David.
Yes.
Sorry to ruin your life, but I get the same calls. They're irate out there. Okay.
I'm amazed by that. I couldn't believe it, but of course, very few people are familiar with your archives, as I am. Probably aren't as familiar with your archives yourself, and I just couldn't believe it. There was such a controversy over this, and you were apologizing to Kathy for not having to bring this up before. And Bob was out there ready to here. You show me your papers, I'll show you mine.
Oh yeah. Well, we stirred it up, David, and I'm just feeling very comfortable about having science lead my way. And when I look at the board, I don't see the science on the other side. And to think that this all got started, Dave, as I can see it, back in 1980s with a company like Nordic Naturals that all of a sudden felt we needed omega-3s in our diet, and doggone it, the best way to get it was fish oil. But there was no science behind why they came up with that. The only thing that there was that our diet, they said, and that is true, is overly stacked with omega-6s, and we really do need omega-3s. That was it.
Well, the problem with that, though, is that all the omega-6s in our diet are rancid. They're no good to us. We're not getting good omega-6s.
We are not getting the good. You absolutely hit the home run there. We're getting the wrong omega-6s.
And so we're trying to compensate for that, because we're getting like 20 to 1 almost omega-6, but it was rancid omega-6, and we're trying to compensate with a higher dose of omega-3s to battle that bad diet.
Yeah, and as if you can't balance it out. If it was a strict balancing, which I believe was the other error in the thinking, was that, okay, it's like a balance beam here. If I got way over here too much omega-6, then I just balance it out with the same quantity of omega-3s. Now we know that it is a balance, and that the proper ratio is 4 to 1. By the way, that happens to be the ratio for the organs. Did you know, for instance, that the skin has a balance of 1,000 to 1 of omega-6s to omega-3s?
Amazing.
And then the brain has a balance of 100 to 1 omega-6s to omega-3s. So
good reasons for that too.
Yeah, there absolutely are great reasons. High fat contents of these areas. The omega-6s maintain the integrity of the structure of that cell membrane, and this is what has led into me tacking on what might at the time have seemed to be completely off the wall. I mean, I'm talking about fish oil one day, and then the next day I'm talking about how you prevent cancer. And I'm hoping people getting the tie-in there. The tie-in is the problem is at the cell membrane.
Yes.
The membrane is where the action is. And if we want to maintain the integrity of that membrane, we better get off the fish oil. We better reestablish the membrane with the right ratio of 6s to 3s with the right parent compounds. I believe that's the other component that is so valuable here. You can't use the derivatives, and EPA and DHA are derivatives. You can't be replacing with derivatives. You have to replace with parent oils, and they are sunflower, primrose, and on the other side, flax.
Yes, but can I sort of vindicate you?
You want to vindicate me? Thank you.
Apologizing last week for not having brought this up before, deciding not to have it brought up before, but you have. And I would send you to your archive, 325, 32309. Some of the last shows you did before you had a problem there.
Yeah, my problem.
31609. 31609, you had Udo Rasmus on. He was only on for about 20 minutes, but he talked about this very same subject. You had him on about 6 to 8 months before that when you had a guy who had the omega-3 diet. Remember he had a chef?
Yes, I remember him.
Right.
It was Udo Erasmus who brought him to my attention.
Yes. But Udo's oils have always been this type of ratio. And he talked about that on your show right before Ed Kane and Patricia were on. And during that show, I can give you a quote. You said you called it a frenzy, the fish oil frenzy, and you said it wasn't healthy.
You know what? You're like haunting me with my own words. I can recall the use of the term, and I think the reason for the apology was I have placed as many people on fish oil as any other practitioner that I know of. And it was only late in the game. I mean, I found out about the issue with respect to the fish oils in about 2005, and because Yehuda it was only him, really, with his scientific confirmation of a 4-to-1 ratio, I needed to wait until enough of the scientists who had tried to reproduce his work could actually do so. And so now here it comes. In 2009, there was a little more information on it. But here at 2011, I can't avoid. This is absolutely the time to shout it, because science over and over and over again has confirmed the Yehuda work. We have to go with the science, and inflammation to joints isn't reason enough to be able to say, oh, I'm going to keep on taking my fish oil. The damage you do to the membrane will have serious consequence and repercussion. And the inflammation that you're looking to quelch can be quelched by the right concentrations of omega-6 and omega-3. So you're right, David. You must have jumped in my archives and went back a tremendous amount of time, because you could cite the date and everything else. So I tip my hat off to you. You use the archives better than anybody I know.
Obsessive compulsive and attention deficit. And when Ed Kane is on the next time, probably won't be able to call in, but if you could push him on something for me, 2 things actually. He talked about Bruce Lipton.
Yes.
And I know just like me, every time I talk about quantum physics and human consciousness, people go woo woo, right? And all of a sudden you're out there, you're way out there. But this is where the real science is today. Is study of quantum physics.
It ties right into what you've been doing for years. The quantum physics issue with your crystals and the energy component. This is really heavy stuff. I like Ed Kane because Ed can really reduce it and making it something that we all can understand. Bruce Lipton, no longer with us, is one of his idols, really. And he knew Bruce Lipton very well. And every time I go to a conference with Ed and Patricia, there's literally a 5-minute memorial lecture that goes on thanking Bruce Lipton for his contributions when it comes to these fats.
Well, as a cellular biologist and somebody who taught medical students cell biology, Bruce Lipton very much got into quantum physics. And what he talks about in his book, Biology of Belief, is that the cell membrane is what is called the quantum observer. And when you get into quantum physics, nothing happens without an observer. And so for us, on a macro level, it's our 5 senses. But on the cellular level, the cell membrane is the quantum observer. So it becomes even more important. And I know Dr. Ed Kane could talk about this.
I will promise you, I was putting a little note to the side to call Ed to bring him back now that the dust is settled, and allow Ed to talk about this membrane once again. There's not one gentleman that I can think of other than Ed that has such an understanding of the membrane, because the membrane is where it happens, and Bruce Lipton points it out in his book, and we better be thinking about how we enhance the cell membrane through our diets and through the appropriate consumption of the omega-6s and the omega-3s.
The other question, Dr. Courtney, would be enzymes, lipase.
Lipase.
When I was taking Abraham Hoffman years ago, I tended to be a little manic, so I would take heavy doses, over 6 fish oils a day, and that would do something with the cellular membrane that my sodium potassium didn't fire so fast, right? And when I took lipase with it, I dropped it down to 2.
How about that?
The same result. So a lot of people, even if they're taking the fats, are not going to be able to digest them, convert them, and an enzyme could be a big factor. And I'd like to hear Ed Kane's take on enzymes, lipase.
Absolutely, and don't forget the other component is bile, because the emulsification of these fats as you ingest these foods is the first step in this process too. So you need appropriate amounts of bile in order to emulsify the fats, and then you need the enzymes to break them down to their most minute component in order to assimilate them.
Right, ox bile, yeah. And omega-7, so Kathy, comes from macadamia nut, and it has a very strong antiviral component.
Good point to raise. I've been sticking with 3s and 6s and 3s, but there are other ones. It's just that any others other than omega-6 and 3, your body can make that particular one, and you don't need to worry about trying to supplement for it. You give it the right amount of 6s, the right amount of 3s, and the right proportions, you'll be able to supply all other fats, whatever they may be. All the other derivatives can be formulated in the body, will make the amounts that it needs when you supply it with the raw materials, the parent oils of 6s and 3s. Dave, I think you got the message loud and clear.
Hey,
Thank you.
As always, thanks for all the great information.
Hey, you're welcome.
Appreciate it.
There you go. David Fish weighs in, and he actually cites to me quotes from my previous shows where we did talk about this. Think about Udo, by the way, Udo Erasmus, which I think I've always tipped my hat off to Udo. Remember, he wrote the book Fats That Heal, Fats That Kill. Udo has always been a proponent of a blend. He's always said a blend of omega-6s to omega-3s, and he's even thrown in some 9s. He knew that it was needed in terms of the blending of them. It's just that Udo didn't have the scientific confirmation of what that blend was. He formulated his own product, and it was a blend, and he wasn't too far off. I want to say this. He wasn't too far off in the proportionality. So, tip my hat off to Udo. Should bring Udo back on the show in the near future, too. So, to close up, as we're coming to the end of the show, I don't want you to get lost in a controversy and miss the entire reason for why we bring this up. It isn't to assault fish oil. It's that fish oils have repercussions by inappropriately forming structures within the cell membrane. And once you get levels of derivatives forming the cell membrane will not be able to transport material into and out of the cell. I happen to pick the big granddaddy that leads to a real big problem, which was the ability or inability to get the right amount of oxygen into the cell. So, talking about fish oils, leading to the appropriate oils, leading to the right ratio, leading to the right parent compounds, and then telling you, with respect to cancer, pretty important medical problem, it's only one factor which determines if you'll get the cancer, and that is the ability to transfer oxygen into the cell and maintain a 35% threshold. And as long as you do, you can never get cancer. Pretty big statement to make, but scientifically accurate because it has never been disproven. So, how is it that you assure that you'll never drop below that 30%, 35% threshold? You better have the integrity of the membrane maintained with the right omega-6s and the right omega-3s. They are the apparent compounds, and by the way, it's all omega-6s and no omega-3s in that particular structure. It's the omega-6s. It's not the omega-3s. The omega-3s are used in beta oxidation. They are used in energy, in the production of energy through burning of fats. But the structural integrity of a membrane that determines what will pass through it and get into and out of the cell is only determined by omega-6s, and by starting with those parent compounds, you will be assuring the body that it will allow into the cell whatever it needs to get into the cell and remove whatever it needs to remove, that cell membrane. Bruce Lipton, you're right, is the fellow who put the quantum physics component into describing why the membrane works as it does. But you all, as supplement takers, need to appreciate that you don't disturb these ratios, and you are doing so by taking in the wrong fats. All right. Perfect crescendo moment. I'm hoping that you're going to have a wonderful weekend. I know I will. Look forward to be back with you on Monday. Don't forget, Roland Thomas is going to be here talking about that BAC, bioengineered algae concentrates. Until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health.